this morning uh, to witness a presentation from the CNMI's Crisis Lifeline program under the Commonwealth Healthcare Center and Community Guidance Center. And this morning we are having the presentation from Ms. Lorenza Smith and Mr. Fred Fatialofa. Thank you so much for actually reaching out to the Senate. We sincerely appreciate your efforts and knowing that there's still a lot of our citizens out there that are suffering from the pandemic crisis that we had faced not too long ago. And I think programs like this is absolutely necessary that we bring it out more into the community so that they know that there are services for them in case they need help. And so without wasting time this morning with opening statements, I'll hand it over to Ms. Smith and Mr. Fred to carry on. Thank you so much.
Good morning, everyone. My name is Lorenza Smith, and I am a 988 crisis responder for the 988 Suicide and Crisis Lifeline under the Community Guidance Center, under CHCC.
Hafele Tito, thank you to Senate President, as well as those senators and respective partners, and as well as the staff for this opportunity. I'm Fred Fatialofa, Program Manager for the 988 Suicide Crisis Lifeline under the Community Guidance Center as part of our healthcare corporation here in the Commonwealth.
Okay, so who have heard about the 988 program? No. Okay. So those of you that raised your hand, what do you know about the 988 program? Mm-hmm. Oh, okay.
Okay.
Thank you.
Yeah, when I first heard about the 988 program, I visited the San Antonio Community Center, the clinic, and I met with Myra Ariola. Yes, and we talked a little bit about how the program works and the number when you call the phone, the 988 number. What I recall there is that if it's after our local working hours, I think it goes directly to the mainland. So that's pretty much about the when you dial the 988. And of course, the signs and like when individuals need help, we did briefly discussed about that too.
Thank you for sharing. Okay, so the 988 program is very new here in the cinema. It launched last year in March. It's not. We want to share that it's not only for suicide, or it's not only for someone that's going to any suicide ideation. It's for anyone that is going to any mental health crisis or just need someone to talk to. They can utilize 988, and we'll talk more about that. Okay, so
Just not sorry to interject, but just so you know that all of these are staffers from the individual offices, some from the OB, and if you can see, they consist of different level of the age group. Some of them are parents, some of them are students, and so this is a good. Thank you for having this. This is a good platform, and for those that don't have, there's some pamphlets there before you. Just go ahead and grab. Thank you.
yes, thank you. Okay, so what is 988? 988 is the universal dialing code that increases the accessibility of life-saving interventions and resource. It offers 24/7 access to trained crisis counselors and or responders. Here in the cinema currently, we are operating Monday to Friday, 7:30 a.m. to 7 p.m. Any calls during the weekends or after 7 p.m. goes to the National Backup Center. So 24/7, if you need help, someone will answer the call. Text is also available here in the cinema, and chat, online chat. Okay, so who can call 988? Anyone in need or who knows of someone in need of assistance with behavioral health related problems, or someone who is going through mental health related distress, whether that is thoughts of suicide, mental health, or substance use crisis, or any other kind of emotional distress. So if a person calls 988, dials 988, you will be given the option to choose one for veterans, two for Spanish, and three for LGBTQ plus. So if you're a veteran and you want to connect to someone who specializes in veteran counseling, you press one. And if you don't want to avail of those services, you just stay on the line and you'll be connected to your nearest call center. They base that on your area code. So let's see. For text service, if you text 988 on your phone, you will be sent a short survey to answer, just so that the counselors or responders know what kind of help you need, and then they'll connect you to a crisis counselor responder. For text services, you can avail here in the cinema. You can use that service, but the responders are not from here. They're based in the mainland. Okay, and then I'm gonna turn it over to. Hold on, I'm trying to. Okay.
So just to backtrack a little bit of history on where 988, like as Lorenzo has mentioned, it's only we've just now been live in all 50 states, including territories and the Commonwealth, for the last 2 years. But it's actually an expansion of, if we all are familiar from the previous suicide, the 1-800-237 talk number. It's just an expansion from that, and then under the Biden Harris, and as Senate President has just mentioned, following post pandemic, numbers have been very in all 50 states, especially in the area of mental health, and we're talking even suicide. It's impacted. It really has changed lives, and so we're thankful now we have this under who we are under with healthcare and SAMHSA, who's our main funder. They've launched this 988, and so we're just now 2 years running, and the reason this reason why 988 is now available, and we're more like immediate response. So there's really 3 phases. What we're really wanting to do is pretty much the underlining goal of 988 is someone to call, someone to respond, and somewhere to go. So the 988 Crisis Lifeline is kind of like that first phase where we want to make that numbers. The end goal is hopefully we can go 24/7, and of course sustainability funding is going to always be the biggest thing what we can do, because our program is only funded for 3 to 5 years, and then after that, how can our local government, our community, how we can sustain having because this what we're really wanting to go alongside. Our main go-to is 911, our first responders, and then 988 comes in alongside as another resource. And there are a ton of trainings that we have under suicide prevention, even under as the Community Guidance Center has provided for our Commonwealth, and what kind of a response that we could provide. Not just as our first responders. We have the really high risk, but then just at a layman's term, as us as a community, what other resources can we, and I know myself, not being from the CNMI, but I'm from the Pacific, born and raised in New Zealand, but lived now in the CNMI for 2006. I've seen and know we as a Pacific people are a resilient people, and we've seen that in this past, with the 2 super typhoons and then this pandemic, the resiliency. So along with what we were doing with 988 is, yes, we're wanting to provide this resource for our community, especially, everybody's going through crisis, everybody, and even, it's not obvious even right now with the state of our economy and all the challenges that we're faced with. Everyone's in crisis, and whether it's family, whether it's in the workplace, whether it's just in the community, and we're thankful for everyone that's present here in this room. We're thankful for the Senate President and our senators for allowing us just to come and provide this resource, because yes, stress is probably the biggest factor in our lives, whether whatever hat you wear, whether you're a senator, a father, a husband, a parent, the different levels, right, in our capacities. But it's very ideal that why we're here as 988, but not only that, we're as a community guidance center, but just that as a community, right? They're saying, I think they're saying is so true. It really takes a village, not just to care or raise a child, but to care and raise individuals that they may be faced with. So what 988 is, as Lorenza and many of those that have gone through the rigorous training, it's all about the immediate response. That next phase I'm talking about is we're trying to work alongside with our first responders is to provide a mobile crisis, because and the team has already responded. There are individuals that will call 988 but are not comfortable in talking to us on the phone, or maybe so we were trying to get a mobile crisis who can go out. Sometimes they don't really want police presence, or maybe they're not comfortable with over the blaring lights. So the mobile crisis then, which will have certain highly skilled providers, whether it's a licensed mental health counselor, whether it's a peer specialist, somebody who has lived experience, as Lorinda has mentioned. Sometimes a veteran who calls 988 would be more comfortable than talking to someone who has lived experience, who has dealt with maybe the coming back from deployment, how to transition back into civil life. So that's where 988 is. We're really wanting to provide that kind of like that high level, more high level, but immediate care for someone who's calling for in crisis, and main also with mental health, where we're seeing already. And we can't blame our first responders. They have their trainings, and when they have to respond to a crisis, and sometimes they may not be aware of the history of the individual. Maybe they have been diagnosed, maybe they have been off their medications, things like that. So hopefully, along with what 988 can provide and CGC, we partner and have a mobile crisis, and hopefully we can even have trainings provided for our first responders. There's a training that some of us are going through right now, which is called a CIT training, which is a crisis intervention training that helps maybe build, like we say, like a task force to help not only in the Sienna, in Saipan, but even now for our sister islands in Tinian and Rhoda, where we could have that task force or have that crisis response available. So when there's a call that comes through, and then maybe one of our crisis responders or even one of our mobile crisis will, be aware of this individual. Oh yeah, this individual, there's history. There's, with mental health or diagnosis or anxiety or PTSD. And so that's, where mobile crisis. And then the third phase is hopefully what we want to see happen is we want to provide what we call like a crisis center or a life center. And, outside of what I do, like hopefully even where some of our NGOs or even some of our nonprofits or even our faith-based could provide that kind of a environment. Because sometimes, many of us here on the island know, our go-to is ER. And even most individuals who are brought in and maybe who are dealing with a mental health crisis or a diagnosis, and they have to be, whether they're intoxicated, then we know the protocol is they have to involuntary rights to send it to our hold in the psych unit. And sometimes that's a very the experience of spending the night in the psych unit. I don't know if anyone here has been, but it's sometimes it can be very traumatic itself. Just that whole experience, that whole ordeal, being in such a facility. So hopefully we can create a crisis center where we have volunteers, we have individuals that, it can be just a place, we provide, it's just a safe space, right, for them to go there. Maybe they just need just to remove themselves from their situation, just go to a place where they can just talk to somebody. There'll be trained volunteers, and there's hopefully there can be a bed provided just for the night or something like that. So that's like the third phase, and what we want to see, happen with this crisis response. So it's like those three different phases. So right now, with me just coming in onto this like almost a year ago, and then just this launching April last year, we're still just at that first phase of um, the crisis lifeline, taking the calls. And like Lorenz has mentioned, that we're hopefully wanting to go to 24/7, 7 day, but again, manpower and also funding as well is always going to be the challenge for us. But this is pretty much in a nutshell what 988 is about. Yeah, like Lorenzo mentioned, it doesn't have to be suicide ideation. If you're just going through a crisis, we had an individual just call because they're just having one of those days. They're just frustrated. One individual who's you know in his bedridden or confined to a wheelchair. They just needed to talk, and they just needed to see what other resources there were available. And so that's great. They can always, and others, a lot of our calls are just people inquiring about, like many have mentioned, they've never ever heard of 988. And but the number does work. We even one time Lorenzo was presenting and somebody actually called while the presentation was going on, just to test whether this thing is legit. We're not just just here to talk story and everything. But yeah, that's pretty much what we're here to provide. It's a resource. It's something that we want to make known and continue to raise. Next month, September, is Suicide Prevention Month. Many of you are well familiar with some of the events that our Suicide Prevention and as well as Community Guidance Center do, is really going out there and bring that awareness. And because if we're very honest, in our Pacific nations and cultures, suicide is still a very, very difficult subject. No matter even now, even for me now being part of suicide prevention and this movement and these services for the last six years, it never gets easier when we hear that we've lost someone in our islands to suicide. And just going there and just sitting down and just trying to provide what we can, and we still, it's a very sensitive subject and something that I'll say will never get easier to talk about, but hopefully we can talk about it. We can address it. We can, even mental health itself, right? Just the word itself, it's still something that it's a tough subject to talk about and address. But I'm so thankful. I'm again to express to our Senate President and our senators and just everyone. And I know you have a love for our Commonwealth and love for our community, for our people. And so this is why we're here and why you do what you do and why we're here to do, just to provide 988. So I think that's pretty much what we want to speak on this morning. We did have a video, but due to the technical difficulties, because I know some of us are visual learners, others are, I'm a visual learner. I want to see pictures or see movies or see things like that too. But we can open the floor up for any questions or any in regards to our presentation and what we provide in our services at the 988 program.
Thank you, Fred. Let me open up the floor on questions. It struck me about the grant that you guys have. And so if I may ask the question, I know you mentioned about the life of the grant is about 3 to 5 years. And so how much is the grant right now that you guys received? And is that a formula grant, a discretionary grant, or how is that been handed down from the federal government? And that's very key, where you all talk about how the state government could carry on the program after the expiration of the grant. And it kind of leads me into other service providers within the CNMI state that are receiving federal grants as well, and whether there's any leveraging that is happening right now as we speak to sustain the program moving forward, should the time of expiration come up. and that there's no continuation of this particular funding?
That's a great question. Yeah. Right now, the program, we're only funded to 2026 as these grants that have been awarded to the for the 988. And I mean, I'll say in dollars sign, it's around roughly what we are awarded for the year is usually about $1 million for the year to run the for our this one is mainly for the just for the crisis responders and for the there is a grant that's been awarded because outside of the grant we it's only for the phone line and the system that we're using that was contracted by our funder, which is SAMHSA, that we utilize that system which captures our data. And one thing that we've got to mention that anyone that calls us, no calls are recorded, and we do not ask for any personal information unless it's something that's unless we engage in our responders are really trained into that when the call comes in, whether to gain that person's rapport, build a rapport, get that for us to get information on the individual. But nothing is recorded, nothing is captured. And like I said, we do abide by HIPAA policies, and everything is kept to the strictest of confidentiality. But I think, yeah, there are some options as you mentioned, Senate President, what we could way of sustaining this. There is with the I believe it's the FCC. There are certain things that we could was mentioned even in our presentation to at the House of Representatives, where there could be a bill that can be drafted where sometimes we only have two providers, whether it's IT&E but where there could be a set amount, I don't know, put aside just to go towards for crisis response. Other states have created things where, I don't know, depending on the size of the state, right? So they bill every billing is like 25 cents or something, or something even not even 25 cents or 10 cents will go towards whether it's crisis response or even for 911, whatever so that's what other states have done, just to try for them, to start building on that sustainability. But of course, they're much bigger states. I just came back from a grant meeting of all the 988 programs, of all 50 states, and you're sitting at the table here with Virginia, and you're sitting there with Arizona, and who have some amazing, exceptional, their crisis response services and the systems they have in place is pretty, but then they're talking about their budgets, and it was like, wow, it's pretty amazing what they're doing and some of them are doing. But they're really key. Even we're thankful to some of our with Guam and along with Hawaii, and who do share certain ideas and some things that they're doing, and some things that I mentioned, and how doesn't necessarily be on a financial or fiscal thing, but could be more so what other resources, like I said, outside of government and outside of the corporation that could be utilized with, I've said, our NGOs, nonprofits, faith-based, that could really help and come alongside and just provide that support as well for the longevity and sustainability, I guess, of the crisis response.
Anybody can chime in, just interrupt me, but I wanted to unload everything that I was taking notes as you all were presenting. But it's always very concerning when we talk about, it seems like we don't have a safe haven for our people to go to. And I hear that quite often out in the community. But I'm wondering whether there's any conversations happening at the state level with partners within the system. For example, under the HUD program, CDBG block grants, where I'll use the example of the soccer field, where that particular facility was funded by CDBG grant. And that's all great because that's healthy physical fitness for our children, our community, but it also contributes to the mental health of our community. But then we talk about having a safe haven for people to distress and just to go to somewhere where it's safe for them, where they could talk to someone and not feel bothered or under any pressure or risk, for example. And so I just kind of want to throw that out to kind of maybe encourage the conversation more at the state level amongst partners, so that we could start looking into other federal grants that could possibly construct this safe haven facility for the CNMI, and that's CNMI wide for all the islands, Rota, Tinian, and Saipan for our people to go to. And so I do want to throw that out. I think that's very essential. Data, you mentioned the word data, and I'm curious to know whether what is the leading factor of the stress level of our community, because it seems like every day we talk about the lack of financial resources within our government, and unemployment rate at 14%, opening of the school where families cannot afford to buy their basic necessities for their children, and whether it's financial, substance abuse, or domestic violence, or what is it really that's, in terms of the ranking of the stress factors in our community. I like to hear about that. I'm sure the senators this morning and the viewing audience public would like to know. That would help us out too in terms of how we address the financials of the government and where do we direct resources to help our people.
Most of the calls that are coming into 988 deal with their concern are mostly financial and family matters, stress and depression and anxiety. We also get some suicide ideation, but it starts from the depression or family matters and financial matters.
If I may insert, I don't know, I'm sure you guys have noticed lately, we've been seeing a lot of individuals in the community that are walking the streets, and people are asking, like, where are they coming from? And who are they? What are they here for? How did they get here? Example, there's one that would just walk in the middle of the highway. Last night I was driving and it's the same person walking in the dark on the highway. And people are wondering, so I don't know whether you guys know of anything that we don't know, of whether these individuals are just coming from the US that are being bussed across the border or put on an airplane to come across the Pacific. I think it's something that the system, our state government, needs to be fully aware of, so that how can we address this issue within the community, because there's quite a handful of them out there, and where is the system in terms of, we understand individual rights, but when we talk about the crises, and if we know of anyone that may be needing of service, us calling it in, or anybody from the community calling it in, because right now I'm very concerned. This is not the first time I saw this person walking in the middle of a traffic, and it's like, he needs help before he gets run over by a car, for example.
Yeah, that's a very big concern, and I agree with what Sen President is talking about. Yeah, we do notice the growing, and I was saying the homelessness on the island, but the ones that we are noticing, obviously, yeah, are not from the CNMI, but we do get those calls, and I believe our other program, our Transitional Living Center program, addresses, working with individuals, and a lot of them, some of them that I have responded to prior to coming to 988, and when I was with the suicide prevention, and some of them, yes, have lived abroad, or some of them have lived in some of the southeastern nations in Asia, and some or another. This was the closest port, or HUD, for of American status, I guess. So that's probably why many of them have made their way here, because I don't know, one individual who I responded to, I guess, was in a relationship in Japan. I guess it didn't pan out, and then so was able to afford himself a ticket to get on a plane to come directly here. And so for the time being, he has family in the West Coast or something, but we do get those calls, and some of them are like with our first responders, our officers do bring them to the psych unit, and like they said, they're only held there for like 72 voluntary hold, and then if our psychiatrists deem them to be, they're able to, they're not a threat to anyone, or they're in their safety, and they're able to, then they're just released, I guess. Yeah, but yeah, we have very limited resources. I know we do have other that are on the island that do provide, whether it's the Salvation Army, whether it's Caradot services, whether it's that can provide, very limited resources. But like having a what was mentioned, like some form of a, whether it's a halfway house or some form of a, like a, even a crisis center, as I mentioned earlier, where a place just they could be brought to, we could just provide, but yeah, there is, I guess, I don't know whether with some of the grants that had been awarded in the past that to try to address the homelessness, but that's for our other programs within the community guidance center. But if for anything, it's always for everyone that's here, it's always doesn't hurt just to always call the community guidance center, and we could provide whatever resources and programs and that are available that can just probably provide.
I wanted to raise that because obviously these individuals have disabilities, right? And so at the state level, we have, for example, the compact impact funds from citizens of the FAS states. And we have these individuals that are coming in, I should say, crossing the borders, and it's the closest port, which is a U.S. Commonwealth, us or Guam. But then I often wonder whether they are also recipients of Social Security disability benefits. I would think that at one point in time in their life, they must have worked somewhere within the United States and earn an income and probably qualified under Social Security Administration benefits. And it's there's just no information at all. It's not being talked about at the state level, but we just see them walking around in the community or just hanging out outside an establishment and just there. But there's nowhere to go. There's no facility to sleep at. Homelessness. We wonder what kind of benefits are they getting, or is the state um, providing the services, and our financials are strained. And how do we elevate the conversation at the state level so that everybody is fully aware, including the legislature, as we address again the financial resources of the government and all the other federal monies that we are managing under our belt. I think it's something that again I would put emphasis on to have a much more deeper conversation with the stakeholders so that we kind of get our hands on all of these issues that we are seeing out in the community right now. And it's very, very concerning.
Just real briefly, if you could, I know you're there's HIPAA, but I wanted to know if you could provide us. Do you guys have engagement with young adults and students accessing the line and using that as a mechanism for counseling and getting help?
Yes, the Lifeline is available to all ages, and we've had callers that are underage. If we've had callers that are underage, but within we still need to move further with like to be referred to another program under CGC. Let's say for counseling, we need parent consent. But yes, it's available to all ages.
And have you seen an uptick in the again young adults, anywhere from 25 down, or just high
Yes.
schoolers?
Most of our callers are young adults. Yeah.
Thank you. So, if I understand it correctly, you guys are talking about the 2026 is when the funding ends for this, and I'm kind of just interested if the grant ends 2026 and if it can be renewed, or is there a plan for it to be renewed?
That's a great question. In regards to, I think with 988 itself, we'll see, because I know this is election year, because then 988 what came out of the Biden Harris administration, right? It was like kind of like their so as of now with our federal partners, right, there's everyone says we'll wait till the result come come November. But with suicide prevention, there's still a lot of I believe there is the grant that I was working under prior to 988, the which was a GLS, was a youth suicide prevention grant. So I believe there is possibly we are. Don't know, but I believe there is a another application being submitted for that grant. And then there's always like only a limited awardees, but fortunately, CNMI and along with Guam have always been fortunate enough to receive those awards. But coming, yeah, I will hopefully by next year we'll probably get more information if there's going to be further grants or what can be provided for just the ongoing, because I believe 90 days is very new, and just coming, like I said, coming back from the grantee meeting that we had recently. Yeah, like they said, after just 2 years of this, they're saying it took decades for 911 to really. So our secretary at SAMHSA, it's going to be, again, it'll take probably, hopefully not decades, but it's still going to be in order for it to be in place. And like we said, as the response we got this morning, not many have heard about 988, and as we hear that from all states. Everyone is always mentioning, like, there's so many that still don't know about 988, and so hopefully by 2026, but maybe that could be still another reason why we want to maybe further the program and further the resources, because just to, again, like I said, with the stigma and with the difficulty about suicide and about mental health being addressed in our livelihoods and our community, it could be a great justification why we can keep it going. Yeah.
Thank you for that. And the reason why I was kind of just wondering about that grant, because for sure I have not heard about 988. This is actually the first, and it's interesting. It sounds like a great program, something where our community can avail to in times of distress, and for us to kind of launch this, promote it, for me to understand this program, and then to just come to 2026 and then this program just dies is kind of a bit concerning and alarming, right? I know for a fact that in the military, let me speak about the military a little bit, that just you're trained to be a professional, you're trained to be a warrior, and to just kind of reach out is kind of hard for most soldiers, right? Service members, and for this program to actually be launched and for it to be available, and then it just shuts down, kind of just hurts that continuity, and that's why I'm asking about this grant. If this grant ends and this program shuts down, do we have a course of action or a plan to try and reach out to other? I mean, given the state of the economy of the CNMI, I don't think this is something that we can deliberate right now and insert into the budget, because right now we're just kind of trying to figure out how to balance it. But I'm sure that there's other grant source, and you've mentioned a few, and maybe that's something that we can start addressing now before that time, just to be proactive, so that when the switch is turned off, you can turn on another switch to just continue the funding source, and this program is not just going to shut down. So I just wanted to mention that.
Just to, like, what you're just mentioning, Senator, and I know you. Thank you for your service. But there's another project that Community Guidance Center we're kind of working. It's called the Governance Challenge, which is more veered towards our veteran population and servicemen, and as including families, right? That and so that's another project that under our I call him the Godfather of CGC. I'm going to get in trouble. Joe Kevin Villa Gomez, he's spearheading this with us and bringing on board, and we're thankful we finally have veterans that are really coming on board, and we're trying to build that side. And we just found out, thankful to our sister island Guam, they've shared that there is a grant that's available to boost up services.
The Governor's Challenge with this 98 program,
It could, but also there's, like I said, there's funding sources now available for veterans for suicide prevention, and where they can avail as well. Similar, like, but it'd be more like a period run by veterans. It'll be more veterans that will be, even running to even do trainings, and that can be provided for.
So that's the challenge, right? It's, if you think about it, the challenge that we have is that there's a lot of great intent in terms of launching programs, but one of our biggest challenges is just continuity. and sustaining that operation or sustaining that program, or even to name the program. We go from, and I guess maybe like you said earlier, right, waiting on the politics of the US to kind of figure out where this takes us. But even the naming of the program, we have this trend of just kind of, we name it this program, then we decide to change it next, add more. And the problem is we're always seeing a shortage in just, or the sustainability is really always the problem, right? I'm sure you guys are facing that, just thinking about when this program would end. Now the challenge is, where are we going to find the funding source for this, and how do we continue to be available to those people in need? Because counseling is not just, it's not something that's just, you know, readily accessible here in the CNMI. So this is just to pick up the phone and call somebody just to talk to. That's, for me, that's a great program. But again, it raises the question of sustainability. How long do we have this, and when does this end, and what's the plan thereafter? So I just wanted to bring that up. Earlier you said that it's not 24/7. Is that correct?
Yes, as of now, yeah, yeah. Yeah, after when we leave the office, then the calls will be routed to our main HUD, and
Okay.
so there will always
So-
be crisis responders from the state
Just
side
wanted to
that-
clarify that,
yeah.
because I was just looking at 24/7
Yeah.
access.
But hopefully for local, we want to
Yeah.
have something, you know.
Yeah.
But like
And I'm sure it's
like
resources.
what you're talking
Yeah,
is,
it's
and
just
it always
resources
falls
and
exactly
challenge.
what you're talking about, Senator. That's going to be the
And this also ties to, I think one of the deliberations up here is that 911, right, and trying to create a system or a taxation system where it just pays itself, kind of thing, to launch that program, right? And 911 will fund itself through taxing cell phones, landlines, and all that, right? And maybe it's another avenue that can be discussed. But given the state of the economy, just talking about taxes just raises eyebrows around, you know. So, but it's something to consider. 988 tagged on with 911 system, I think it's a great opportunity for us to just try and look at continuity and sustainability for the future, something that we can discuss. Again, unfortunately for us in the Senate, we can't just introduce legislation that's tax related, but you know, something that we can discuss with our colleagues in the House. So thank you.
Thank you.
Hi, thank you and good morning. Earlier, I think I kind of heard with Senator Carl's line of questions. Let's just say a minor calls in, you would have to refer that minor to another program. Is that correct?
No, if the minor is going to avail of our services, like just active listening, or we're doing CSSR, if that minor is suicidal, or we try. Our concern is for the safety of the caller. But then for further treatment or follow-ups, we need the consent of the parent.
But in terms of initial, the initial call that kind of has them.
Yeah. No,
wanting
we'll
to-
make sure they're safe first, and then that's when we'll go out and get consent
Okay.
that your child called. But most of the calls we got for kids, for individuals under 18 are actually their parents are there, or parents are the one that call in for them.
Okay. How well do you guys go out and, I don't know, maybe advertise or spread the word about the availability of this hotline?
Okay, so that's what we're doing now. We're trying to reach out to the government agencies. I just got an email today from the school, from PSS. So we're reaching out to the schools also, because we want to present to the parents, the staff, and the students especially. So yeah, so we're scheduling every week. We have presentations. We're going from one government department to another. So
And NMC? Oh.
we did NMC already.
Okay.
Yeah, we did presentation.
Yeah, I was just asking because, maybe you're aware that we had one case on Rhoda earlier this year, and then shortly thereafter there was another attempt. And so even just now, while you were doing the presentation, I was asking one of the teacher, I was like, do you know about this 988? But she has no idea what that is. And so I'm wondering if, that is at least maybe something of an area of concern, maybe, or maybe a major focus should be pushed to at least the school level first with the students and what they're going through, especially when hormones are, at its peak, and all these students have these different emotions. And so I think, not to say that there's not much of a greater concern out in the community, but at least with the students and what they're going through with their parents and all these financial stuff. I hope that that's something, especially after an event like this that just happened on Rhoda recently. All these other students may have these similar thoughts stemmed from that one event. And so, yeah, and I hope that as we see the increase maybe of people reaching out to this program, that's a greater push to fight for and argue for future funding to help support the program. And so, just a recommendation and observation. Thank you.
Thank you, Madam President. Good morning and half day, everyone. Welcome to the Senate. Just continuing on the line of questioning, and I appreciate the conversation from the Vice President and Senator Carl, and of course, the President and Senator Dennis. But it appears that what jumps out to me is like what was mentioned earlier. How much of this has been actually brought up in an open forum to the stakeholders, not just the members of the legislature, but I just saw an email that you guys we're gonna have, not you guys, but we are gonna have a proclamation. But to what extent have we done to collaborate with other partners like the Carried Odds and other similar entities to come together and just announce that we have 988. This and what you just said to us earlier is exactly what it is for the community, and it doesn't have to be a monthly thing, but it can be just blown up to allow getting to know what you guys' programs are offering. And I too believe that the more that we get the traction on this, the more weight that is going to place on funding source that you're going to request. Not mentioning or not promising anything yet, but again, and I also want to encourage you that PSS gets 25 cents to the dollar, and there's 10,000 students, and there's a lot of like what Vice President is saying. There's that level of the adolescents where, so maybe partner with them as well if you haven't, to see how we can merge the program so that we can be able to plan to 2036, not just the fiscal cliff on 2026. That's number one. Number two is capacity building on counseling. I know it's a struggle because I've seen it from participation from other jurisdictions, that they always have to struggle in rural areas because they actually go and seek employer services elsewhere, bigger cities, better pay. So we got our work cut out with that. So that's the reason why I wanted to kind of just mention that the capacity building for treatment, intervention versus crisis management. And I'll leave with this. That actually gave me compelled me to introduce that legislation that became law, the behavioral health scholarship for graduate school, that became law a couple of years ago. It's going to be administered by the scholarship office. So I don't know what the statistics now as far as cohorts, but these are evidence to what we've been seeing, what we've learned, and the concerns primarily to address the issue with the community. So I applaud you guys for coming here and showing us this 988 service. But I also I want to respectfully ask that merge together with other participating stakeholders or service, like the what I mentioned earlier, to try and get the maximum reach for this in the CNMI.
Yeah, thank you, Senator. That's some really great what you just mentioned, and that like moving forward is something we really want to do, and it's been shared by um uh Senator Donald and Dennis without we always can never forget our two islands of Tinian and Rhoda, because something that's always dear to my heart. When I always say, um, when you just hear about the loss of one to suicide, and even more so, right? You got to just do the math more so, like for Tinian and Rhoda, right? Like one loss there, but per population, it speaks volumes, the impact of it on a smaller scale, right? But why I think, um and I said this, just know this, and then one thing that with CGC and CHCC as a whole, how we could continue to do that, whether, like you said, we wait till proclamation to do something to raise awareness or suicide prevention month, but something to keep ongoing, and I think that's where that saying, well, maybe how it can probably, I guess, break down the stigma or somehow make it a easier conversation, is whether
Sure.
we can make this conversation an ongoing, like, no matter how difficult it is. But I can never say we can never normalize it, but the attempt, right? Like the
Right.
attempts that we're doing at just making these conversations about mental health, about suicide
Sure.
itself, how can we really make it easy for that conversation to happen, and more so, we're thankful on our island. There are so many great partners, like as you have mentioned, and I always say, when we come out to Tinian and to Rhoda, we see the community come together, and whenever there's a loss, but even on these events, whether it's Suicide Awareness Month, or whether it's something about cancer, or something about, it's always evident. So I think moving forward, I think it's on
Yeah.
our part, and I'll take that to heart as well. Where more needs to be done, and more needs to be brought to the table to try to, again, continue the awareness and the movement. Yeah.
Thank you. And Chris, just so thinking to circle back on Ms. Smith, you said majority, or if not the prevailing number, that in your opinion, that it's all about the finance side of things, or financial struggles.
Yes, and depression, which stems from the
Sure.
financial hardship, family problems, relationship. But then that, if they call in because they're having anxiety or depression, it mostly stems from the financial issues in the family. I also wanna let you guys know that the 988 number is accessible to prepaid numbers that don't even have load. It's free, just like when you call 911, you can still access the 988. And it's free. And if, for example, someone calls 988 and we refer that person, let's say, to one of the programs under CGC for counseling, and they're on the wait list, and or they're being seen, but they still want they want us to do follow-ups and check up on do wellness check. We do that also. So, and we don't just get the call and then that's it. We do follow-ups. We want to make sure you're okay. We do follow-ups once or twice a week. It depends on the person. So we don't just refer you to another clinic and then that's it. If you want us to be doing wellness check, we do that. We even do mobile response where we go to the person's place of residence.
Ma'am, just while I'm at it,
Yes.
can you give us a ballpark figure?
Of the numbers of
Just
number of calls.
the financial,
for-
what are in your
And maybe, let's say, maybe out of all the calls we got since we launched, our data guy's not with us, but I'm guessing like 50% of the total calls are related to financial matters or stemming to finance.
just
Yes.
when you get a caller and then you do escalate to treatment or some
mhm.
other step beyond the 988, is there a cost associated with it for the caller?
Oh no, all services under CGC are free.
Okay, thank you.
Even the 9.
Senator Karina Magonia.
Thank you, Madam President. I'd like to first thank you for coming in and sharing this wonderful information and just really educating us about the service that's available for our community. If I'm not mistaken, I think you guys did come in last year as well, or was this your first time here? Or I may have attended it at the house. But is this your first time coming to the legislature about this program?
Yes, it is.
Oh,
Yeah, yes.
then I must have heard it then someplace else. But thank you because it has been quite some time, obviously, and it's very useful and helpful information. I just wanted to concur with Senator Donald's recommendation as to maybe prioritizing the students, especially like in the middle school and high school. We know that a lot of the students go through so many different things, with life and at home, especially. And I think it would be great if they know that they have this outlet to call, right, and just to talk to somebody, especially because even for those with prepaid, even if they ran out of the minutes, they're still able to reach out. So that's great information to put out there. I'd also like to just kind of touch on Senator Mendiola's idea of possibly collaborating with the 911 and maybe including the, some kind of collection to pay for the program. Maybe not call it a tax, but some kind of fee, like a surcharge or something. But I know that works. On Guam, the utility company actually took out a loan. GWA took out a loan, a huge loan to improve and repair the water infrastructure and sewer, right? And what they did is they actually embedded that fee onto like the hotels, so that the tourists are kind of like paying it without really knowing that fee is embedded in there. But there's so many ways to collect on fees to help sustain the operation. I was curious, how much does it cost to operate this program on an annual basis? Just the ballpark figure.
As I shared earlier, because there was we got awarded two funding sources, which like totals to around $1 million a year, which takes us to
$1 million a year. Okay.
yeah, which will fund us till 2026. Yeah,
Okay, so you got more than $1 million then for the next, so $1 million every year.
Yeah,
So okay.
yeah, and it's possibility like Senator Mendiola had mentioned, there are possibility where we can request. So sometimes like with the funds are not utilized, but we can always
Okay.
request for the extensions, and hopefully, like I was saying, we're waiting because this 988 program kind of came out of the Biden-Harris
Got it.
administration, so we will wait for the result of the election, and then possibly
Okay.
SAMHSA will, if there's a possibility, there will be more funding or grants that will be able to, just I believe with it, I'm an optimist, but I really believe there will be further funding would be available just to
Yes,
continue. Yeah.
yes, I do too. I do apologize. I came late, and you probably may have already shared it in your presentation earlier. But when did the program first start?
So 988 went live of April 2023.
Oh, so just last
Yeah.
year. Okay. And then, do you have any data as to statistics of the number of calls that you have received to date, the different types of calls? Yeah.
Yeah, we do have data. We didn't bring it with us, but
Okay.
we're happy if there's emails and that we can share.
Okay.
We
I
can
would really love
we
to
can
see the
we can share
data.
that data with you
Yeah,
and make it
just to kind
available.
of
Yeah.
really understand what's going on behind the scenes, right?
Yeah.
And what our people are experiencing, and help and see how we can help if we can.
Yeah.
Right? Yeah. I will provide you my email address after. So that's all.
Under CHCC, is your information accessible on their website? Or is that something that you guys want to consider uploading so that everybody could have access to that information rather than dealing with hard copies or emails and things like that?
We can work with our because it can be made available, but we'll just have to get because sometimes even when we're sitting presentations, like I mean, this is not from '98, but some of the things for suicide prevention, some of the numbers that's provided from us, like when we go out to present on, like to our community, sometimes our numbers have to be approved, certain numbers, and sometimes we hear it from a community because sometimes they say they don't agree with sometimes for our first responders, some of our numbers.
And I think that's very key
always
because
we have that. But like you said, President, yeah, those numbers can be made available and probably can be put on the CHCC website.
So I think
public
this is when
viewing.
it talks to data, because of other programs that are providing the same services to the community. For example, suicide prevention, taking calls, whether from your 988 number or 911 or through Carry Dot. That I think what I'm looking for also is the uniqueness of data and not to be repeated, so that we could truly have an understanding of what percentage of the population, like you shared, that 50% or more of your calls had to deal with financial stresses of families and individuals. And that 50% population likely would be the same population that Carrie Dot could be dealing with. So the uniqueness of data, and I think this is why it is so important that partners come together and share their data so that the unique number is actually reported out to the stakeholders like us, so that when we're looking at funding and trying to identify financial resources, that we are truly identifying unique count of the population base and not scattered numbers out there. But I know we're going to come to an end, and we do appreciate this, but I would encourage you guys to push forward with the housing corporation conversation. If you drive around, there's some vacant inventories of housing, and this is very dear to our hearts. Senator Donald for sharing, what happened on Rhoda, and Saipan has his own experiences, and Tinian as well. The youth in our community, including the adult, they need a safe haven. And if it's anything that the state government can do, is to give up a facility that is currently vacant and rehabilitate it so that our people could go somewhere and just be safe and recuperate and not necessarily stay in the same environment that could be causing their stresses and their anxiety and the thoughts of suicide and all the other issues that they are facing in the family. I think this is something that as a state, no one can deny and no one would take a back seat on, that this is at the forefront of social issues, community issues that we all need to embrace and push forward with. I tell you this, I'm gonna push forward with NMHC. I will carry some conversation with them and to reach out to you guys so that hopefully not just one, but maybe a few facilities that you guys feel is safe, that is away from the people so that everybody maintains their confidentiality for security. I'll share my own history way back in time. I have driven someone to a safe home somewhere here on Saipan. I have rescued someone in the parking lot of the hospital. And I had to maneuver myself so that I also do not get hurt, just so that I could release the individual into the hands of the state authority due to domestic violence. And so those are kind of stuff that, we don't often talk about of what we do personally, but I do recognize that there's no safe haven in our community right now. And it's something that we need to do at the state. Last comment from Senator Dennis Mendiola.
Thank you, Madam Press. It's just interesting that we just mentioned about the importance of the data statistics, right? And just to hear that 50% of the callers are youth, that's, for me, that's just quite alarming. So we're already in a state of financial crisis, and we're going to be seeing more of it probably in the next couple of years. So talking about data statistics, that tells me automatic, just looking at or hearing this, is that those numbers will probably go up, with given what's going on right now. So just to illustrate the importance of that statistics that these guys were talking about, because I guess when the Senate, my colleagues and we deliberate up here, I think that's the most important piece of information for us to make those decisions, because like you said, 50%, that's very alarming. So I just wanted to stress that. Thank you.
Okay, thank you. Just a quick one. On the 988 call center, I'm just wondering if it's on a rotary system, like when you have a caller already, and not sure how many staff you have that receive the calls, so that the line doesn't go busy when
Yes.
another caller is trying to reach you guys.
Yes, it's there's three lines that take 988 calls.
Okay.
Yeah.
Thank you.
I also want to share that you can call on behalf of someone. You can call as a third party caller also. Yeah.
Thank you so much
So
for.
in closing, I think we just have two things we want to do. Just we have a quick survey. I know it's won't hold you from your lunch, but we just have a quick survey for everybody, just for again data purposes. And then could we request a photo with a?
Absolutely. I was just going to say we're going to do
Yeah.
a group photo.
But yeah, just closing. Just Jesus Masi.
I'm
Wine.
Dumas.
Thank you so much,
Thank
Senate
you.
President
Jesus
and
Masi.
senators for again for
Thank
this
you.
opportunity.